Welcome to our channel, HASHMICLINICS.
Welcome, everyone. In this clinical monograph, we are going to do a deep dive into the materia medica of a fascinating remedy. It's one of those that, while you might not use it every day, it holds the key to some really challenging cases, especially those that mix arthritic and eczematous symptoms. Our goal here is to build a really precise, clinically useful picture so you can spot it and prescribe it with confidence.
So, right off the bat, this is the remedy's absolute core. We're not just looking at three separate problems here, some eczema, some arthritis, some bladder issues. No, we're looking at a single, unified disturbance. Think of it like a disease process that jumps between these three systems. The real genius of ARBUTUS is its ability to treat this entire complex, especially when there's that underlying uric acid tendency.
Here's our roadmap for today. We're going to start with the basics. Build up that core clinical picture, then zero in on the keynotes that really make it stand out. After that, we'll compare it to some other remedies so you don't get them confused, and we'll wrap up with the nitty-gritty of how to prescribe it.
Okay, let's kick things off with Section 1, Introduction and Essence. To really get a feel for this remedy, we need to know where it comes from. Now, its family, Ericaceae, is a huge clue. This family, which also gives us remedies like uva ursi and kalmia, is famous for its action on the urinary tract and on rheumatic conditions. So right away, that anchors ARBUTUS in a very specific therapeutic group. And all our knowledge really comes from the incredible clinical work of Dr. Archie Cooper. His original observations are our foundation.
All right, on to Section 2, the core clinical picture. This is where we take that basic profile and see how it actually shows up in our patients.
I'm going to say it again because it's that important. The whole prescription really hinges on you spotting this triad of pathology. A patient who just has eczema or just has arthritis probably doesn't need ARBUTUS. We're looking for that case where, say, the suppression of an eczema breakout is followed by the appearance of gouty arthritis. It's that dynamic shift that should make you think of this remedy.
So these are the conditions your ARBUTUS patient might walk in with. The eczema is usually the dry peeling kind. The arthritis is gouty, and it loves to hit the large joints. The bladder symptoms? Think cystitis or grit in the urine, and you'll see it clear up cloudy, sediment-filled urine. And the lumbago is often rheumatic, tying right back into that bigger joint picture. And this quote, "This is pure gold." This comes right from Dr. Cooper's notes, a direct observation from a patient. It cleared his urine. A simple sentence like that is often worth more than a dozen repertory rubrics. It's raw, it's real, and it confirms the remedy's cleaning out action on the urinary system. It's a powerful supporting symptom that links everything together. You have to be on the lookout for this alternation. This is a top-tier grade A symptom. When your patient tells you, my eczema has gotten a lot better, but now my knees are killing me, or the other way around, a light bulb should go off in your head. That shifting of symptoms is a huge signature for ARBUTUS.
Okay, Section 3. Let's really dig into the keynotes and peculiar symptoms. These are the details that give the remedy its unique signature and let us prescribe with real precision.
The doctrine of signatures can be incredibly insightful, and for ARBUTUS, it's just so vivid. The tree itself gives us this amazing clue about how to use it. So the tree sheds its bark every single year. It literally peels. And what is the remedy's #1 skin indication? Peeling, shedding skin conditions like eczema. It's a beautiful, classic example of a guiding symptom straight from nature.
Now for the joints, there are two key notes you absolutely have to burn into your memory. First, it goes for the big joints, hips, knees, shoulders, not the small joints like you might see in other remedies. And second, the modality is extreme. The slightest movement causes inflammation. Now that immediately makes you think of bryonia, right? And we'll get to that comparison, but for now, just lock that in as a top symptom for arsenicus.
Okay, Section 4, Sphere of Action. Let's consolidate our understanding of which body systems this remedy really targets.
So this chart gives you a nice visual. You can see that skin and joints are the main event, right? That's where most of the action is. The urinary and musculoskeletal systems are important supporting players. But remember, a successful prescription isn't just about what percentage. It's about that alternating pattern between the top two, often with that urinary symptom showing up alongside them.
Now, it's really important to be honest about what we don't know. The sources give us this incredibly clear physical picture, but the mental and emotional state, it's still a bit of a blank slate. And you know what? That's an opportunity. That's where your own careful case-taking can actually help write the next chapter of our Materia Medica.
All right, Section 5, Comparative Materia Medica. This is crucial. You can't prescribe accurately if you can't tell this remedy apart from its close cousins. So let's put it side by side with some lookalikes.
Let's really break this chart down. Bryonia is a big one. It shares that intense aggravation from the slightest motion, so it's an easy mix-up. But the bryonia patient is dry. Dry mouth, dry cough, big thirst, with sharp stitching pains and that irritable don't touch me, leave me alone mental state. Arbutus doesn't have that. Then there's ledum. For ledum, think of rheumatism that starts in the feet and travels up. The huge giveaway is the temperature modality. Ledum's joints feel better from cold, even if the patient feels chilly. Arbutus has nothing like that. Calmia, another family member, has pains that jump around and travel downwards, often with a cardiac symptom, like palpitations. Arbutus pains tend to stay put in the big joints. So you see, the thing that always brings you back to arbutus is that eczema-arthritis alternation, plus the clearing of the urine.
Okay, let's bring it all home. Section 6, Prescribing and Clinical Application. Let's talk about the practical details of putting this remedy to work.
The aggravations are really clear. We've already hammered home the aggravation from the slightest movement. But look at this other one, aggravation from northeast winds. I mean, how strange, rare, and peculiar is that? If a patient happens to mention it, that's a massive confirmation.
As for potency, what we see from the historical sources is a range from the mother tincture up to the third potency. This kind of suggests that its action is more on the physical tissue level, which lines up perfectly with its strong clinical picture.
So here's a simple, 4-step checklist you can run through in your head to confirm your prescription. 1. Do you see that skin joint connection? 2. Are the large joints affected? 3. Do you have that Keynote modality, worst from the slightest movement? And 4, is there that urinary component? If you can check those 4 boxes, you can prescribe Arbutus with a lot of confidence.
So I'll leave you with this question. Arbutus andrachne has a really clear but also a very compact clinical profile. And that means every time you prescribe it carefully, you have a chance to add to our collective knowledge. What mental symptoms might you see? What new modalities might you confirm? That discovery, well, that's the living, breathing art of our Materia Medica.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.